right, so all hour long, we are talking about the latest methods and treatments men are taking to look and feel their best. Now we're getting to the root of one of the biggest concerns and insecurities for men, and that is hair loss. More men are jumping into the conversation, especially young men. Gone are the days of your grandfather's hair plugs. Advancements in technology have brought hair restoration to a whole new level with procedures like plasma injections and even robots helping with hair transplants. Also joining the conversation, Dr. Michael Wolfeld, a board-certified physician in both plastic surgery and hair restoration. He's a nationally recognized expert and specialist based here in New York. Welcome to the conversation. We have some statistics. According to the Cleveland Clinic, 25% of bald men see first signs of hair loss at age 21.
That's right. So people can notice hair loss early when they're younger, and it's important to take note of it. And a lot of times it's your family history. So you have to look at both sides of the family to see if it may affect you. But if you see it going on early, it's best to come in for an evaluation because there are medical treatments you could start on which can really help you.
So I was talking about medical advancements. Zeph, you recently started something called PRP. We actually have video of this, and we should know Zeph is not one of your patients, Dr. Wolfeld, but,
That's right.
But you practice this process as well. First, before I ask Zeph how it felt, because I was passed out at that needle, tell me what this does to his body, or any patient's body who gets this blood plasma.
So the idea behind it is that you're drawing your whole blood and you're centrifuging to separate just the platelet-rich plasma portion of your blood. And your platelets have specific growth factors that when concentrated and injected, they can help to stabilize your hair, can help to thicken your hair as well.
So your blood, and then it's treated and split.
That's right.
The richest part of it then injected into your scalp.
That's right. That's right. Exactly.
We have...
Yeah, it's like spinned, and then they take the top half of it. And
so we have photos of you, Zeph, before and after. Oh, wow.
Yeah, it looks a lot different. My hair was washed over here and it was a little bit longer, but I did see it grow a lot faster during these times where I got the injections, yeah.
So tell us about the hair transplants today versus, I mean, I'm a news journalist, and I remember early in my career looking at the man next to me, and I was like, he's got hair that he didn't have, but I could see the little injections.
That's right.
You can't see that in the plugs, I guess they were called.
That's right. That's right.
That's different. It's different now.
Totally different. They used to be called plugs or doll's hair-like appearance.
Right.
Yeah, because you used to take thick plugs from the back of your head and physically transplant them to the front, and it looked completely unnatural. But the way that we do transplants today, it looks completely natural. And
how do you do them today?
So there's two methods. There's what's called FUT, which is follicular unit transplantation, which is a strip method, and FUE, which is stands for follicular unit extraction or excision, where we remove the grafts individually one by one. And then we transplant to the thinning or the balding areas to really add fullness and density.
So the next level of the technology is that you may be on the cusp, or society may be on the cusp of cloning hair.
Right.
In the next 10 to 15 years, you believe that's going to be a reality?
I do. They are doing a lot of research here in New York and in Europe.
What does cloning hair mean?
So how it works is not completely understood yet, but the idea behind it is that you take a small amount of hair from the back of your head, you send it to a lab, they can replicate it and make as much hair as you need. And in that way, we can give someone who's fully bald a full head of hair at that point.
So on your journey, Zeph, what's next?
What's next? Well, much later this year, I plan to get a hair transplant.
Okay.
And alongside that, keep all the routine that I've been doing to keep my natural hairs.
Yeah.
Because the transplant hairs will stay, but my current hairs are going to continue to fall out if I don't stay consistent on a hair routine.
That's amazing. Well, thank you, Zeph. Thank you so much. Dr. Wolfeld as well for being here.